box. So please type your name, the outlet you are affiliated with, and your question exactly as you would like it to be read. Please submit those before the last speaker is finished speaking, and then we will read them aloud during the Q&A portion. So thank you again for joining us. Today we will have Dr. Grant Colfax, Director of the San Francisco Department of Public Health, Dr. Joaquin Torres, Director of the Office of Economic and Workforce Development, Cheryl Davis, Executive Director of the San Francisco Human Rights Commission, James Spagnola, Executive Director of Collective Impact and Ella Hill Hutch Community Center, John Jacobo, member of the Latino Task Force, excuse me, and Stephanie Garcia, a Juvenile Justice Reform Fellow. So with that, I would like to turn it over to Dr. Colfax.
Hi, good morning, everybody, and thank you for joining us before this long weekend. I just have a brief statement to make with regard to where we are in the COVID-19 pandemic and the public health message, and I think the message that is really that we need to send out across the city, across the region, across various neighborhoods and communities, is that this 4th of July, the safest thing to do is to stay home. In San Francisco, we have had an alarming increase, a significant and alarming increase in COVID-19 infections and hospitalizations. Over the past few weeks, our rates have soared. We are in a situation where we could be seeing early signs of a surge, and certainly our increases are reflected in across the region, and as we are seeing increases across the state. As people know, we have put a pause on our reopening, and it is really vital that everyone take the steps that we know stop the spread of COVID-19, slow the spread of COVID-19. This means wearing face coverings, social distancing, good hygiene measures, and really limiting outings and staying at home as much as possible. We know that this works. We saw that this worked in the spring with our response in San Francisco. And as we hit pause, we need to ensure that we're doing everything we can to slow the virus's spread. So key message this weekend: stay at home if possible, celebrate at home with people in your household, use as much as possible a way to socialize virtually, socially distance, wear a face covering, safe, keep you, your family, and your neighborhood and community as safe as possible. Thank you.
Thank you, Dr. Colfax. And up next, we have Director Torres from the Office of Economic and Workforce Development.
Thank you so much. And thank you so much, Dr. Colfax. I just wanted to make a few brief comments about the importance of moving into this weekend. And like many of the small businesses and community members who are very much looking forward to a more aggressive reopening, we're just very thankful for the leadership of the Department of Public Health of keeping our health interests very real and grounded during this significant time that we're in right now. I think we're all excited about a long 3-day weekend and what benefit that may bring to some of our struggling small businesses that are doing everything they possibly can to provide healthy experiences and safe experiences for those who visit them and patronize them, which is very, very much needed in this environment right now. But it's important to remember that this virus doesn't take a holiday, but it may force one further upon all of us that we don't want if we don't all take the collective responsibility as business owners, as patronizers, as community members, to ensuring that we are adhering to these public health guidelines. It is so, so important that the progress that we have worked so hard to create in terms of phased reopening through our office, under Mayor Breed's leadership, with the leadership of Dr. Colfax and Dr. Aragon, we very much want to continue to see that progress being made. It is only possible if you as the public, if you as business owners, do your part to be responsible during this weekend and as we continue to mitigate the public health crisis that we find ourselves in. Again, we have been doing such an extraordinary job ensuring that we could get to this place of having many small businesses and businesses begin to see light at the end of a tunnel, to allow for them to enjoy some level of activity and seeing liveliness come back to our neighborhoods and our neighborhood commercial corridors. It's only possible, again, if all of us are working together to take care of each other, to practice these social guidelines. It benefits not only our health, but our economic health as well. And that's something that we very much need to keep an eye on, and we all have a part to play in that. Over 153,000 residents in San Francisco that have sought out unemployment. We know that we are dealing with an unemployment rate well over 12% at this point right now, and our job collectively is to adhere to these public health guidelines to allow us to continue and battle the other economic crisis that we want to be sure we can successfully address. And together with all of you, we know that that we can do that. When it comes to some of the additional work that can be provided, or signage and information that can be provided, we want to make sure that businesses know that there is additional collateral that they can collect and gain access to help them work together with their patronizers and those who decide to come in and patronize their businesses, retail or otherwise. But we really, really do want to say thank you so much to the public for being patient with business owners who are simply trying to do their part and be as successful as they can be in this environment. So with that, we're very much looking forward to taking questions later on, but very much looking forward to a safe July 4th weekend here in San Francisco and across the Bay Area. Please do, if you're a business or an employee, for more information about resources or tools that can be made available to you, please do reach out to our website, oewd.org. That's oewd.org. And then also, if you're curious about the phasing that's going on and what plans we have there, please do visit sfgov, search for reopening, and you will find the information that you need there. So thank you all very much for the opportunity today. We look forward to working with you towards continued success and reopening.
Thank you, Director Torres. And our next speaker is Cheryl Davis, the Executive Director of the San Francisco Human Rights Commission.
Thank you. You know, Director Torres just talked about the virus does not take a vacation or a holiday. And I think, you know, Dr. Colfax and I have been having conversations about how it also is not equal in where it is impacting communities and neighborhoods. We have seen that the map of where the virus is impacting in greater numbers matches maps that have been used for redlining. It matches maps that have been used to highlight disparities in terms of economic and health issues and challenges. And so we realize in some ways, as people have talked about this, we are battling two diseases or two issues at this point in time. One is the pandemic and one is racism, that these two things are very much closely connected. We are seeing a surge, as we have talked about, within our Latinx communities and in the Mission and other neighborhoods. But most recently, we have had concerns about our African American community and issues and challenges facing folks in Sunnydale and with younger populations. We are really trying to make sure that folks are heeding the call to stay home, to stay healthy. We are working with community. The role of the Human Rights Commission during the pandemic has really been to listen to community, to engage with community, and raise the community concerns. We have heard from young people and old people alike that there is a concern that folks are going to come out over the course of this weekend and think that everything is fine and then be worse off as we go into next week. So we just really want to encourage people to talk to their family and encourage them to stay home, to stay healthy, and be aware of asymptomatic. The idea that someone could have contracted the virus and not know it and be spreading it to others. So we have been, as a part of the Human Rights Commission, working with partners like Mr. Spingola and Collective Impact and Del Seymour and Donna at Code Tenderloin to distribute face coverings, to pass out sanitizer, and to also pass out collateral that says stay home, stay safe, reminds people of where they can get tested. And so we will continue that messaging, but are really grateful for partners that we have like here today that can share and encourage others. Really grateful for the work that John and the Latino Task Force have been doing. We really have to think about how we make this message plain, that we talk about in plain language, comorbidities, the ideas that folks that have already issues, health issues, are more likely to contract the virus and have a harder experience or be harder impacted by that. So we really are trying to work with messaging around that so that folks realize, although they are not being mandated, that we are really strongly encouraging that people stay home for the safety of themselves and their communities.
Thank you, Director Davis. Our next speaker is John Jacobo, who is a member of the Latino Task Force.
Hola, buenos días a toda mi gente. Good morning, everybody. My name is John Jacobo with the Latino Task Force. And the Latino Task Force, since the beginning of this pandemic, has been working vigorously to ensure that our Latino community can continue to thrive in this city, or attempt to thrive in this city. And as Director Davis just indicated, there are a lot of challenges that the Latino community faces in San Francisco that run parallel with COVID, and that COVID in many ways is making much worse and highlighting. And so one of the big pieces of advice to anybody that's listening out there, anybody that's jotting this down, is to ensure that if you have the ability to shelter in place this weekend, that you do that. That if you have a need to go out because there's an essential thing that you have to do, that you wear a face covering and a face mask. As we saw in a mission study that we did, the Latino Task Force partnered with UCSF, we found that 53% of the people that tested positive in that particular mission study were asymptomatic, meaning they had no symptoms. So what could be happening is people could have COVID-19 and not understand that they do, and they could be completely fine and not have any symptoms, but give it to somebody that they love dearly that could have a very adverse impact or adverse effect. So we are reminding our people in community to ensure that you stay home if you can, and if you have to go out, that you wear a face mask and that you ensure that you're keeping the social distance that's appropriate. And if you're listening to this message, then you are an ambassador of this exact same message to those that you love and those that you care about. And it's important for all of us to take ownership of this, because it's only with all of us participating that we'll be able to get out of this. So again, if you absolutely have to go out because it is essential, please use your social distancing space and wear a face mask. Make sure that you have your face covered, and that you enjoy this as safe as you possibly can.
Thank you, John. Our next speaker is James Spangola, Executive Director of Collective Impact in Ella Hill Hutch Community Center.
Yes, can you hear me now? Yeah, how you doing, everyone? You can, I'm not sure if you guys can hear me. Can somebody let me know that they can hear me?
Yes, we can hear you. Thank you.
No, thank you. Okay, how you doing? My name is James Spangola. I work down here at Ellie Hutch Community Center, and I'm gonna go a little deeper than that so community can understand who they're talking to. So basically, I am Uncle Stank, right, in the community. So I always tell everybody, if you come to my community and you ask like, where's James at, nobody would know who you're talking about. You come through here and ask where Uncle Stank at, everybody in the city knows where I'm at, okay? But I just wanted to kind of reach out and talk about, I was just having this conversation with somebody the other day. I knew from day one, when this pandemic started, that Ellie Hill Hutch was going to open up their doors to community, because I knew the resources was going to be hard for our community to get a hold to. And I just wanted to make sure that, our community had somewhere to go, and somewhere where they can go get some PPE, some face masks, some sanitizers, or whatever else they need. We even did hot lunches here, right? So I just wanted to make sure that, community just really knew where they were, the doors was open. They didn't have to go looking for anything. It was right here. I've been all over San Francisco and Potrero Hill, Devil Rock, Hunters Point, the mission. We have been pretty much kind of supporting everybody with PPEs. And I know everybody is feeling a little cramped up, the 4th of July coming up. And so I'm just going to say, in my words, right? Like, keep your butts at home. Like, everybody, please stay at home. Because this pandemic and this COVID is for real, right? I mean, and I don't want you to be the person that carries it home. And I know a lot of us go home and we have family members, and I know everybody want to get together during the week, right? And go do the 4th and go kind of have, kick it with the family, do the 4th of July or do whatever it is that you do, right? And then you got to realize you go home and you have a mom at home, you have a grandparent at home or something, and if you don't even know you're actually carrying the disease, right? So it's like, I mean, we as young people really, you are the carriers, but it's like looking out for the people that's around you at the time, right? So it's not about you. It's bigger than like everybody else. I always tell everybody, it's bigger than me. It's bigger than you, right? It's about protecting all our elders and our seniors and all our family that's around us when we think about it as we go out, right? So I'm basically saying, like, if you do have to go out, right, wear a face mask. If you do end up going out, wear a face mask. You make sure you got sanitizer with you, right? Think about social distancing at all times. Just make it a habit that people just don't get next to you, or people keep your distance from you, right? So just make sure that that you take it serious, because this is serious. And I'm a reason why I say this is serious, right? Is because when we think about it, there's a lot that's not being said, right, and a lot that we don't know about this virus that's out there. So I mean, just to be safe, right? It's just make sure that you're taking care of like your people, your loved ones, your community, right? And just making sure that you actually letting everybody know that, hey, like, I don't want to get sick. I don't want you to get sick. Like, so I'm going to keep my distance. I'm going to stay at home. I'm not going to be out here. I'm not going to be part of that. I mean, because I always tell everyone, we're going to recover from this. We're definitely going to recover. But I mean, we're going to go through some stuff for a minute, right? And stay at home and just being safe for this weekend. And please stay at home and be safe. Because I mean, the last thing in the world you want to do is sacrifice somebody in your family, and the last thing in the world I want to do is go to another funeral. So I mean, it's just like at the end of the day, it's for us to look out for our communities and make sure that our communities is safe at the end of the day. So please, please, please keep your butts at home, stay home, y'all, and just kind of like, I mean, there's another 4th of July will come up, and just, I mean, we'll get the next one next year. We'll probably be out there partying, but for this year, please just stay at home. Thank you.
Thank you, Director Spingola. And up next, we have Stephanie Garcia, who, as a reminder, will be our final speaker. So please submit your questions before she's finished speaking.
Hello, good morning, everyone. I'm here today to talk specifically to young people. So I have a message for all of the young people in San Francisco and around the nation. We, the young people, are intelligent, courageous, and resilient, and we can lead here by example. So I urge you to continue to practice social distancing and to only go out for essentials, to wear face coverings, and to practice good hygiene. Remember, COVID-19 is something that affects all of us, and especially those whom we love. Our moms, dads, grandparents, great-grandparents, and others with underlying conditions in our communities. We as young people have the responsibility to act responsible and to leave our pleasures and fun behind. The Rona is real. I have firsthand lived through the fears of having relatives test positive and lose their lives to COVID. I also know what testing positive does to a family financially. In some situations, many of us live in multi-generational homes, meaning that we live among the elderly, our parents and grandparents. We as young people must remember that we are not spared from this virus. We have seen how serious COVID can be for our elderly people. Those that We all respect, care, and love unconditionally. I urge you all to take action and practice social distancing, practice good hand hygiene, and continue to wear face coverings. We all have the power to flatten the curve and stop the spread. Thank you.
Thank you, Stephanie. With that, we will begin our Q&A portion. Our first question comes from Rebecca with Cal Matters, and that is, what percentage of cases tell contact tracers they're close contacts? Has that percentage changed over time? And when cases don't tell investigators they're close contacts, do they say why? And I apologize, that question is for Dr. Colfax.
Could you reread the question again? I didn't quite hear all of that. I'm sorry.
Yes. So the question is, what percentage of cases tell contact tracers they're close contacts? Has that percentage changed over time? And when cases don't tell investigators they're close contacts, do they say why?
Got it. So contact tracing is one of our key interventions that we employ as a result of managing the pandemic. So right now we have over 100 contact tracers in the field working with people who have been diagnosed with COVID-19. Right now we are reaching 82% of cases. And of the people that the cases report, we are reaching 88% of their contacts. So we are doing relatively well there. For our indicator, we're in yellow there. Our goal is to reach 90% for both. And with regard as to why people do not necessarily tell people about their contacts or perhaps refuse with regard to engaging with a contact tracer. We have qualitative information about that. Obviously, there's understandable concerns about providing information and how that information will be used, which is why we have worked very much with multiple community partners to train efforts by community-based organizations to function as trusted contact tracers with the communities that we need to reach the most right now, given the inequities during the epidemic. So contact tracing is about the information that's given, but it's also about providing support for people diagnosed in their contacts. So with the partners on this call across the city, people are being offered hotel rooms if they need to isolate and quarantine. Their families are being offered social support services, food, and other key things that help people if they're diagnosed with COVID-19, if they're at risk for COVID-19, and to help them get through the 2-week period that is most acute with people who are diagnosed. The other thing to emphasize is that the information that is gathered is 100% confidential and is not used in any other way except for getting people tested and supported during COVID-19.
Dr. Colfax, the second question from Rebecca with Cal Matters is, how have moves to reopen San Francisco complicated contact tracing efforts, and what have been the consequences of that?
It has not complicated our efforts. We are continuing full court press in working to, in a culturally appropriate way, engage people who are diagnosed with COVID-19 to, again, support them, to support their families, and to support the contacts that they've had. And again, it just emphasizes the need to continue to strengthen this work across the city.
Thank you. Our next questions come from Angelina with KTSF. These are for Dr. Colfax. The first question is, how do we celebrate the 4th of July with our families safely?
Well, I think as I said at the beginning of the call, and my partners on this call also emphasize, the best thing to do is to stay home, celebrate with members of your household, and to be able to celebrate virtually with others. it's really a key right now that we prevent the spread of COVID-19, that we slow the spread. If people do go out, again, to emphasize wearing face coverings, maintaining social distancing, which, I know it's hard sometimes for me to do, it's hard for people to do, but we really need to emphasize that. And as Director Davis emphasized in the comments, even if you feel okay, that doesn't mean you don't have COVID-19, or if someone feels okay or looks like they're not sick, up to half of the cases can at least initially be asymptomatic. So we've got to continue to prevent the spread, wear the face coverings, social distance, and good hygiene.
Second question from Angelina with KTSF for Dr. Colfax. Other counties allow social bubbles. What is your position on small gatherings of close family and friends?
Yeah, so I think that the safest thing to do is to stay at home with members of your immediate household. If there are times when people decide not to do that, it's very important for people to meet outside, wear the face covering, social distance, the hygiene measures that I talked about. And I also think we need to be really thoughtful about how we engage outside of our immediate households with people who are at highest risk from dying of the disease, people who are older, people with chronic conditions. So I think that right now, again, the best thing to do, given what we're seeing in San Francisco and in the region across the state, and indeed in many parts of the country, we are having a dramatic increases of cases, but San Francisco knows how to do this. We did it, and I'm grateful for everyone's contributions to this. We did it in March, we did it in April, we did it for much of May. We can do it for 4th of July.
Thank you. Our next questions come from Kathy Novak with KCBS. These are also for Dr. Colfax. The first question, how many patients from San Quentin are currently being treated in San Francisco hospitals?
So the latest data we have is there are 18 patients who were transferred from San Quentin who are in San Francisco hospitals.
Thank you. Second question for Dr. Colfax. Are San Francisco hospitals preparing to receive more patients from San Quentin, and how is that likely to affect capacity?
So right now, our hospital capacity is good per our indicators, which, by the way, people can find on the Data SF website if people want to delve into these in more detail. But right now, our hospital capacity is green. We have a capacity to accept patients from other regions in the state. Obviously, we will balance our ability to accept with what's happening locally and watching those indicators very, very carefully. But we certainly want to be able to support regions where there's an acute need and where people are in dire need of care. And we are in close contact with the state, which is really determining how patients from San Quentin will be potentially transferred to other counties.
Thank you. Our next questions come from Christian with KTVU for Dr. Colfax. First question, can you speculate about what is leading to the recent increase in coronavirus transmission rates in San Francisco?
Well, I think it's likely a combination of factors. We don't have the precision to identify any one thing. This is not an outbreak that is in one specific facility or region. It's really, I think, what we know spreads the virus, which is people, unfortunately, have been doing closer contact with people who may be asymptomatic but still can transmit COVID-19. The people who choose not to wear facial coverings, which we know dramatically decreases spread of the disease. And then I think, per the conversations and data that we've had in the past, there are people essential workers who need to work in settings, and there is certainly a transmission risk in some of the workplaces, even with proper precautions that are being taken as much as possible. So the social distancing, the facial coverings, the hygiene, ensuring that people have access to testing to know their status, the contact notification, all these are things that can prevent the further spread. And we think that over the last few weeks, it's probably just a combination of more activity in the city. The more we move about, and the more interaction there is socially in gatherings, the more likely the virus is to transmit, especially indoors, and especially if people don't take the precautions that we keep talking about.
Thank you. And the second question from Christian at KTVU: did we reopen too fast or too early? Are we likely to see some of the restrictions reimposed?
So I think as we have reopened in a very cautious and I think data-driven way, we followed the data and science and facts with regard to how to reopen gradually. We knew the virus numbers would increase in our city and our region. The goal here is to slow the spread as much as possible. And the reason we took a pause is because the rate started to increase dramatically. So we've talked about flattening the curve. So it's not as though there would be no increase in virus numbers, in cases diagnosed, and in hospitalizations even. It's really about this rate. I think it's too early to tell whether we would need to potentially reverse any steps that have been taken with regard to reopening. We're taking a pause. We will be looking at the data, particularly over these next few days, and make a determination on next steps, again, based on the data in science.
Thank you, Dr. Colfax. And we have our final two questions from Joshua at the SF Examiner for Dr. Colfax. Question number 1, please discuss the latest data that is raising concerns, including the exact number of case increases you saw on Wednesday.
So the most important data that are causing concern are really around the increase in hospitalization rates, and in the rate of case diagnoses. So our goal for 7-day average of new cases is 1.8 per 100,000 residents. We are now at a rate of over 6 per 100,000. So that pushed us into our red zone. So that's one of the key indicators. The other key indicator with regard to hospitalizations of people diagnosed with COVID-19, our goal is to keep the increase in hospitalizations to less than 10%. That puts us in the green zone. As of our most recent data, our increase is now at 61%. So, a key piece of this is our hospitalization rates overall for COVID-19 are low in the city. Again, thanks to the incredible efforts of San Franciscans doing their best every day. So our hospitalizations remain relatively low, but that rate of increase means that the curve is steep, and we really need to ensure that we're doing everything we can to flatten that curve again. Because as we've seen, we saw this in China, we saw this in Italy, we saw this in New York. We're seeing this now in Florida and Arizona. Once this virus takes off at a high rate, it's very aggressive, and we need to take this pause now, and as much as possible stay at home for the 4th of July in order to get that curve flat again in San Francisco and in our region.
Thank you. And question number 2 from Joshua at the SF Examiner. Can you provide any more specifics about what trends you are seeing in terms of why there is this increase of cases and hospitalizations, such as demographics, location, or other causes?
So again, I think it's a combination of factors, and the data really reinforce the continued and ongoing need, as others have spoken to on this call, to focus on through an equity lens in our approach to managing COVID-19, to supporting communities where COVID-19 is disproportionately affecting people. That includes the Latinx, the Black African American community, and we will continue to redouble our efforts in working with key partners, including those on this call, to do just that.
Thank you, Dr. Colfax. This concludes our press conference for today. We want to say thank you again to our speakers for joining us, and a recording of this press conference will be available shortly. Thank you.